Hey guys, welcome to my favorite episode called To Medicate or Not to Medicate? That is the question. So, my degree prepares me to be able to have this conversation because in some states, with a doctorate in clinical psych, a PsyD, you can prescribe. The reason is that we are knowledgeable in people, not rats. So, I don't have a PhD, I have a PsyD, which means that I study people, but I also took psychopharm, neuroanatomy, anatomy and physiology, pretty much every course out there on psychopharmacology. And I got actually accepted to get my master's in psychopharm, which eventually I'll probably do once I find the time. So this is not a battle of counseling versus medication because I'm a fan of both. It's just that there's no perfect drug. My favorite professor, Dr. Schlossberg, and I used to have a conversation of what the best drug would be. And we think that it's probably Ativan or Xanax because it binds very specifically to where you want it to. And it has a fast mechanism of action and onset. So you feel it right away, which is great if you're trying to sedate somebody. But there's always side effects. And with every drug, there's side effects. And usually you feel the side effects first. So even with antidepressants like Lexapro, where the onset is a little bit faster, it's still going to take 3 weeks and you're still going to feel the side effects first. So part of my job is to tell people, don't quit your medicine because it has a lot of benefit, but you got to stick with it. And that counseling plus medication yields the best results. It's happened time and time again in every single research study. Because yes, drugs can help you focus, they can help lessen anxiety, there's a place for them, but it's not going to fix your relationship, it's not going to make you more organized, it's not going to help you manage your time. It only helps with some things, but not all. And so I am very knowledgeable with regards to medication. I'm not a psychiatrist, but there is a psychiatrist shortage, and that 70% of medications given are not given by psychiatrists at all. They're given by nurse practitioners, family practitioners, pediatricians, and OBGYNs. And I think that leads to a large margin of error. And so part of my job is about psychoeducation for pharmacology, and that let's make sure, A, that we're treating the right thing, B, that you're on the medication that is warranted, and C, making sure that it's necessary or that it's functioning the way that you want it to. So I do know a lot about medicine. It's one of my favorite hobbies, really just limited to psychiatric medicine, of course, because that's my area of study, but it is something I feel confident talking to my patients about, and likely that sometime in the future, people with my degree here in Georgia would be able to prescribe, since that has happened already in numerous other states. Like I said, I feel like there's a place for it,